Hi guys, welcome back. Today is a really interesting surgery, especially for all you sportsmen out there who are using your shoulders and you're afraid that you're going to get injured and it will affect your playing and your fitness. This surgery is something you have to watch. Today we have a very common injury of the shoulder known as a rotator cuff partial tear. Now, as all of you know, if there is a complete tear of the rotator cuff, we have to repair it or stitch it. If there is a partial tear, we can identify the tear without opening it up using a high frequency ultrasound. In the ultrasound, you can actually see the tear in the tendon. Now, this sportsman has a tear in the subscapularis, which is also a part of the rotator cuff and the supraspinatus. I am sure all of you would have heard of the supraspinatus muscle. It is the muscle which is responsible for us to be able to throw and for us to be able to do this action. So if you're able to move in this 30 degrees to 90 degrees, then your supraspinatus is all right. If you're unable to or you have some pain, it could signify that you have a supraspinatus injury, a tear, or a tendinosis, which is an inflammation. Now, this patient had an injury which caused a partial tear in the subscapularis and in the supraspinatus. And today we will be using fluoroscopy and high frequency ultrasound in order to identify it and inject platelet-rich plasma and BMAC, which is bone marrow concentrate, which is filled with healing cells, mesenchymal stem cells, and also a lot of healing factors, which will help his injury recover faster than it would otherwise do. Apart from that, injection of steroids into the shoulder joint, into the tendon, is not a very good idea. So if any of you sportsmen have a partial injury, a partial tear of the ligament or a muscle or a tendon, think of platelet-rich plasma. Platelet-rich plasma can be injected with ultrasound guidance straight into the tear, especially if it's a partial tear, and that really helps the injury to heal faster and also for you to recover and go back to sport faster.
Hi, hello, ellarkum vanakkam. Actually, my name is Mithun Maheshwaran and I am an actor. So what happened is in my shooting in fight scene, I got fall down in ground and I hit it in my right shoulder. So the problem is I can move my hand front, I can raise my hand in front and upside, and I can rotate from here. It's not a problem, it's so easy. But same time I cannot move my hand in this angle, right angle. I can take it up, it's paining. I am so impressed what is told me is very promisingly, because he is giving me new technologies, things, and that technical words. Hope I will get well soon by tomorrow itself after this surgery. So tomorrow itself I think I can feel my rotate my hand fully, I think so, in all 360 degree.
The shoulder is an extremely important joint because it is the joint which shows that we have mobility over stability. Think about it. You can move your shoulder 360 degrees from the entire angle. So when you're able to move a joint that much, what you lose is stability of the joint. And very commonly that affects us as a rotator cuff injury or an injury to the supraspinatus or subscapularis. There are other two rotator cuffs also. They are known as the teres minor and the infraspinatus. So if you have an injury of the rotator cuff, you don't have to worry. It does not have to keep you away from sport. There are a lot of minimal access, non-invasive techniques using your own healing cells with which we can repair your problem and get you back to sport right away. Alright guys, signing off. I really hope that you found this useful. And if you like the information, subscribe to my channel and also press like and the notification button so that you get such information whenever you feel like. Alright guys, bye-bye. Signing off, Dr. Santhosh Jacob.